thrust of what I focus on really, is the how do we help people live really, really rich and rewarding lives despite the fact that, pain's tagging along with them.
Uh-huh. Yeah, and you kind of mentioned it a little bit, but you're kind of diverting away from this old biomedical model of healthcare, if you would, for more of a biopsychosocial. So can you kind of explain for someone who hasn't heard, what is biopsychosocial healthcare? What is the biopsychosocial model, and how do we apply it?
It's really thinking about the person in context. So when we have an experience, we know, for example, with pain, that there's going to be some neurobiological aspects. So there might be some things in the periphery. There's probably going to be changes in the central nervous system as well. And so we know that, but that doesn't add up. It's not enough to add up to why is this person presenting in this way at this time. So a biopsychosocial model says, yes, you've got this biological stuff happening, but here's a person and they've got thoughts and beliefs and attitudes and emotions. They've got attention. They've got the cultural context. They've got the life context that they live in, and all of these factors interact to create this experience that this person says, I need some help with. And I think that's the gist of it. It's really person-centered care in its broadest sense.
Yeah, so we're not just looking at it as at a symptom or a diagnosis. We're kind of taking a look at the whole person, right?
Yeah. And when it comes to persistent pain, pain isn't just a symptom. It is an experience that takes a life on of its own, and it might be that becomes the disease. And that's what the ICD-11 new characterization of or classification for chronic primary pain is. It says that actually, rather than being just a symptom of something that we haven't solved, let's acknowledge that it is a disease in its own right.
It's its own diagnosis.
Yeah.